thank you for joining this IHSS webinar that CSAC is co-hosting with CWDA and CAPA. We appreciate you taking time to learn about the IHSS program. My name is Justin Garrett. I'm a senior legislative representative for CSAC covering the human services policy area. And as we all know, IHSS is a critical program that helps vulnerable individuals remain safely in their home, and the value of the program was definitely highlighted more than ever during the ongoing pandemic. We also know there are significant county and complex county responsibilities for funding for the program, and that's what today's webinar is focused on. These responsibilities have changed quite a bit in the past couple of years, so this webinar will serve both as a refresher course as well as an update on some of the new things that were changed this past summer. So with that, I would like to now have our co-presenters introduce themselves for today's webinar. So we'll start first with Eileen.
Good morning, everyone. My name is Eileen Kubansky. I'm the Deputy Executive Director and Director of Budget and Fiscal Policy at the County Welfare Directors Association. I'm glad to see everybody virtually.
Good morning, Karen Kiesler, and I am the outgoing Executive Director of the California Association of Public Authorities, soon to be retiring and joining you from North Carolina.
Good morning, everyone. Rashmia Duree, Associate Legislative Representative for CSAC. Thank you.
And before we get into the heart of the webinar, we actually have a surprise announcement that we're going to do. So every year, CSAC honors individuals in the county family who have made significant contributions to county advocacy success. This is known as our Circle of Service Award. And this year, we are honoring Karen Kiesler. So we don't know when we'll have an opportunity to present this award to her in person. And so we thought we'd take this opportunity in front of all of our county colleagues and friends to honor her great work, both over this past year and since 2010 as Executive Director of CAPA as she heads off into retirement. Karen's been a tremendous partner and advocate on IHSS, an indispensable resource on the program history, and has contributed greatly to a number of key wins in the advocacy arena over the year related to the MOE, collective bargaining, wages, and benefits. So we'll definitely miss her knowledge and her friendship, but we wish her the best of luck in her retirement, and just want to take this opportunity to celebrate her work, and a quick round of applause for Karen. Thank you for everything.
Thank you so much. This is really incredible. Back in 1991, I was at CSAC, and then I won what was called the Frank Messplay Award for the work done in shaping the 1991 realignment. So this is an incredible bookend to a career that's meant the world to me, and I can't thank you enough. I wasn't going to ever have this Tammy Faye moment, and you guys just killed it for me. I'm sitting here with tissue, and I really thank you.
Absolutely, Karen. Thank you for everything. And we give you a little break before you have your talking part of this webinar. So covered our speakers, and let's talk about what we have planned for today. We're going to quickly recap where we've been in the past couple of years with a couple of the recent MOEs and where we are now, just to set the stage. We'll talk about how admin funding works. We'll spend the bulk of the time on wages and benefits and collective bargaining and caseload growth, because we know that's where there's been some recent changes. And that's also where county and public authority staff kind of have the most day-to-day work as the ongoing implementation of the MOE continues. And then we'll have some time for questions at the end. All right, so first, let's recap some of the recent significant MOE changes. So we're just going to focus on what we call the MOE era. We know there's a lot of IHSS program history and important stuff before that, but starting in 2012 is when we had the first maintenance of effort that was linked to something called the Coordinated Care Initiative. And this MOE was implemented over a couple of years and was in place until 2017. At that time, there was a trigger in the CCI that if the state determined that they were not achieving the appropriate savings, they could switch the county MOE back to the historical rate sharing ratio that existed prior to the MOE, which would have resulted in $600 million of costs and IHSS costs shifting to counties in 1 year. That was very unsustainable. CSAC negotiated a new MOE that was enacted through SB 90 that included some offsetting revenue to help absorb those costs, and that also included something we call the reopener provision that required the MOE to be revisited in 2 years because we knew it was unsustainable for counties beyond that. And so that then kicked off a 2-year period of a sustained county advocacy with the legislature and the administration, making the case for why the 2017 MOE was not sustainable long-term. We had our 3 key advocacy points about the growing gap in IHSS costs that were available versus what counties were responsible for, that IHSS program costs were having negative impacts on other realignment programs, particularly public health and mental health, and that counties needed additional revenues in order to make it sustainable. The reopener provision required a 1991 realignment report to be issued by the Department of Finance. This report crossed 2 administrations, developed heavily in the Brown administration and then ultimately released in the Newsom administration. The key major findings for counties related to IHSS were that 91 realignment revenues could not support the cost of all the programs that were realigned, primarily because of the growing IHSS costs. And the report made specific recommendations in order so that counties wouldn't have to use significant county general fund, and that health and mental health could receive the general growth that they needed for those programs. So going back to our timeline, this 1991 realignment report was released with Governor Newsom's first budget in January 2019, ultimately enacted in SB 80 as the new 2019 MOE. Very few changes from what was proposed to what was ended up being enacted. And then this past summer, some of those changes occurred to wages, benefits, and bargaining provisions, and we'll spend some time talking about what those look like today, and that was through AB 135, a budget trailer bill. So let's review the main provisions of the 2019 MOE. So that proposal, again, as I mentioned, it followed the recommendations that were issued in the 1991 realignment report, and it was a very significant commitment of state general fund costs by the states for IHSS costs. We're talking hundreds of millions of dollars per year. That is an ongoing commitment, and that is a growing commitment. And this was done out of recognition that counties could not sustain the costs that they were responsible for before that point, that counties were facing the same several $100 million gap each year that was growing. And so this MOE aimed to solve that issue, and a big commitment of the state to make that possible. So here are the key provisions of how it works. The MOE base statewide was lowered to $1.56 billion. It would have been in 2019-20, $2.06 billion. Part of that would have been partially offset by the offsetting revenue, but definitely not all of it. The annual inflation factor by which counties' costs grow was reduced from 7% of the prior MOE to 4%. I would note that there is a provision, there's not a provision rather, to suspend or reduce that 4%. It will be 4% every year, no matter if realignment revenues decline. The previous MOE had a provision where it could have been reduced from the 7%, but of course 4% is better, and was done in alignment with historical realignment revenues growth. Now, we've already seen a year where realignment revenues did decline, but overall a huge win to get the inflation factor down to 4%. There were significant changes to wages, benefits, and bargaining that we're going to spend a lot of time talking about today. And so ultimately, each county has a MOE amount that would only increase by the annual inflation factor, and then the county share of any locally negotiated wages and benefit increases. IHSS administration costs were pulled out separate from the MOE and are funded through a general fund allocation. We'll talk about how that works. So really, another key thing that the 2019 MOE accomplished is it got rid of all of those complicated offsetting revenue provisions that existed with the 2017 MOE. So growth funds through realignment were being redirected from health and mental health and CMSP to social services just to help counties try to cover IHSS costs. There was a state general fund mitigation that would be distributed to counties to help with those costs. And now both of those things have ended. And so now the state's just picking up those increased costs, whatever they end up being, rather than a set amount that would be distributed among counties to help counties. And then accelerated caseload growth was implemented with the 2017 MOE, whereby counties would receive the caseload growth associated with increased costs in the year that they were happening. Incredibly complicated mechanism, very difficult to implement and to account for. And so now IHSS will return to the normal caseload growth process, and we'll talk through how that works today. So a lot simpler and a lot more straightforward with this current MOE. The key thing to implement it was, of course, to determine what county amount each individual county would have. And so CSAC had an existing IHSS working group that we were using for our advocacy efforts. We developed an IHSS MOE subcommittee that developed this methodology. There was consensus there also among CSAC leadership, CAOs, Department of Finance, and Department of Social Services. Everyone was on board with the methodology, and essentially what it did was just remove those increased costs in the same way that they were added. So every county had a part of that 330 million state general fund that ended and a part of that 7% inflation factor. So when those were taken off, they were taken off in the same way that they were added to counties. And then from there was only a $32 million difference between what was left and the final 1.56 billion MOE amount. And so there's just a 2% cut for every county to get to that final amount. Here's a graphic that shows visually how that worked. But again, pretty straightforward, strong consensus, and every county had their MOE amount starting in 2019-20 and continuing forward to the current year. And so with that, we're now going to turn it over to Eileen to talk about county administration.
So one of the big structural changes when we transitioned to the new MOE in 1920 was, as Justin alluded to, the removal of administration, both the county IHSS administration and public authority administration from the MOE. Instead, now what happens is state general fund is provided to cover the total estimated non-federal administrative costs. So every year in the Budget Act, the Annual Budget Act, we have a capped allocation or a capped amount of general fund that is provided. As part of that removal from the MOE, they did remove any statutory requirement that the counties have a county share of cost for the non-federal costs. They fund that all with general fund, but the general fund is only funding estimated costs. So to the extent that estimated costs are off for some reason, then the general fund may not be adequate statewide. And if a county or public authority expending exceeds their capped allocation amount, then 100% of those additional costs above the capped allocation are a county-only expense. And that overspending that you might do on administration does not count towards satisfying the rest of your IHSS MOE requirement. And what this then does is put county IHSS and PA administration back into the state general fund allocation environment. For county IHSS administration, for 2021-22, we are budgeted to receive a total of $317 million general fund. This is growth of about $14.5 million more than 2021. The budget methodologies for how the total amount of funding for IHSS admin for the counties and PAs was redone a few years ago. The budget methodology itself is okay, but it does have a major shortcoming in that it does not fund annual cost increases. So this growth funding that we have for this year actually is only covering caseload growth costs. These funds are allocated to counties, so there'll be a county fiscal letter that comes out for those of you familiar with the human services world. We work with the State Department of Social Services to determine the county by county distribution. We have only distributed, based on a new methodology, the growth money. That's to ensure that every county at least receives as much as they received in the prior year. And then next year, or for this year rather, 2021-22, every county has a little bit of growth. That CFL with the allocation is not yet released. We are anticipating it any day, but it is extremely late this year.
Public authority administration is a lot like the county administration in terms of being outside of the county IHSS MOE, and that any county expenditures for public authority administration are completely voluntary. There's no required county contribution to public authority administration. The state general fund portion is $26.1 million, and just like county admin, the state's formula to determine the amount of money that they invest in public authority administration was based solely on caseload growth, not on any increase in the cost of doing business with the public authorities. Next slide, our increase this year, again, based solely on caseload, was $1.2 million. Public authorities between 2009 and the previous MOE changes, there was a huge difference in the amount that the public authorities received from the state. So a high priority of CAPA has been to move towards equity in the allocation of the state general fund. Therefore, public authorities are grouped by caseload size, and then there's a comparison of the distribution of the non-federal funds, and then we use that to determine the allocation of the growth. All of the public authorities received some growth in their allocation this year. Some were very small. Some were pretty sizable because the public authority was so distant from other comparably sized public authorities. The one point I really want to make here is, finally, is on the public authority administrative rate. Unlike county admin, the state requires every public authority to submit an administrative rate that they evaluate and approve. They will never fund over their approved rate. So the public authority rate has to be adequate in order for a public authority to pull down their full state general fund allocation. If it's too low, then you're leaving money on the table that the state is not going to send to you. Even if the public authority has legitimate expenses and claims, the state will never reimburse over the approved rate. So the public authority rate has to be adequate. It doesn't have to be accurate. The state works closely with public authorities in order to make sure their admin rate can match, but we still have some that the public authority rate is too low to completely pull in their state general fund allocation.
Great, thank you, Eileen and Karen. And we'll now move on to our next topic, which is IHSS wages and benefits. There have been a number of changes in recent years, really mostly about new tools being enacted to help counties and provider unions reach collective bargaining agreements. And on many of these, we've worked in partnership with the provider unions to establish these tools. And so this table here just shows a little bit of the timeline of what's happened in the two MOE bills, and then most recently with the budget trailer bill this summer, about how various tools have been enacted or changed or extended. We're going to talk through the details on all of this. And I would also note we have a resource that we'll link to at the end of today's presentation that is going to outline everything we cover in this section and then the next collective bargaining section. So just a quick reminder on the process. Once once a wage or benefit increase is agreed to, there is a process for submitting that to the state, and that's outlined here. The Department of Social Services, Department of Healthcare Services, they're really reviewing just for compliance with the law, not to say that a county can or cannot increase the wage. And so as long as everything is good on that front and appropriately submitted, that wage increase will then go into effect in the way that it's outlined on this slide in terms of the timeline. So when there is a wage increase, there's the federal share that is covered by the federal government, roughly 50% of the overall cost. It certainly varies by the different types of IHSS hours. And then the non-federal share is split between counties and the state. The state will cover 65% of those non-federal costs for local wage and benefit increases that are adopted through one of those ways on the slide there. And they will participate at that 65% rate up to the state participation cap for wages and health benefits, which is $1.10 above the state minimum wage. So currently $15.10, that'll increase to $16.10 January 1st, 2022. And there is a tool available to get state participation in a limited amount above that cap. We call it the 10% over 3 years tool, and we will talk about how it works. And before we go through how everything currently operates, I did want to just outline what we accomplished with AB 135 in terms of a budget proposal that we were successful with this year. So under the 2019 MOE legislation, there were some changes that were going to happen this coming January 1st that would have really had some negative impacts on collective bargaining, would have stalled progress. County costs for wage and benefit increases would have nearly doubled had changes not been made. And so our organization, we sponsored a budget proposal with a couple of the county partners and provider unions to prevent these changes from occurring and to ensure continuity for the existing collective bargaining funding mechanisms. And we were successful in getting that included in AB 135. So specifically, here's what would have happened. the sharing ratio would have flipped and the county would have been responsible for 65% of the non-federal share and the state would have only been responsible for 35%. The state participation cap would have ended, so the state would then participate in all wage increases and benefit increases, but at that new lower rate. And this also would have made that tool that allows state participation above the cap ineffective, as there wouldn't have been a cap anymore. So what will now occur is the sharing ratio will remain at 35% county, 65% state indefinitely. The state participation cap will also continue at that $1.10 above state minimum wage. And the 10% over 3 years tool has been extended with 2 new uses that we'll get into how that works. One tool that was established in 2017 that hasn't changed at all since then is the wage supplement. Essentially, this is a way to adopt a wage increase and have that wage increase amount continue to float above state minimum wage as state minimum wage increases. So any wage increase can be adopted as a wage supplement. There's really no reason to not adopt it as a wage supplement. All counties can use this no matter where they are in relation to the minimum wage or to the state participation cap. And it can be combined and to use at the same time as the 10% over 3 years tool. So a county just needs to indicate that it is a wage supplement when they're submitting the rate change. The MOE will be adjusted in the same way for any other wage increase for the county share of that wage increase. And the state participation depends on those other factors, where the county is in relation to the state participation cap, whether it's using that other tool or not. And so what happens is the wage increase goes into effect, and then there are subsequent applications of the wage supplement whenever state minimum wage rises to a level above the county wage absent the wage supplement amount. And then there are no new MOE adjustments for these subsequent applications, and they will continue as long as applicable as state minimum wage continues to rise. So let's walk through a couple of examples of how that would work. That's probably the easiest way to see. So say currently we're here in November 2021, the state minimum wage is $14, county is paying state minimum wage, agrees to a wage increase of 50 cents as a wage supplement. The IHSS provider will be paid $14.50. The county will have the county share of that 50-cent increase added to their MOE. We come to January 1st of the coming year, state minimum wage increases to $15, so it rises to a level above the county wage absent the wage supplement amount, because the county wage would be, the $14 still. And so that means that the wage supplement will be subsequently applied. So 50 cents is added on to the state minimum wage. The provider is paid $15.50, and there's no new MOE adjustment for this 50 cents floating on top of the new state minimum wage. Here's just another example of how it would work if you're a county that's already above minimum wage. Maybe you had existing wage increases that weren't done as a wage supplement. So you're already at $14.25. You do a 75-cent wage supplement. The provider's paid $15. State minimum wage goes up to $15. It's above the $14.25 amount. So the 75 cents is added again as a wage supplement, but anything that wasn't a wage supplement essentially gets lost as state minimum wage passes it. And so there's a $15.75 wage for the provider in the new year because of the wage supplement. Next up is the 10% over 3 years tool. So this was first established in 2017. Again, can be used at the same time as the wage supplement. County must indicate they're using it when they submit the rate change. And all counties can use this tool, but you can only use it once you're at the state participation cap. So if you're below the cap still, you don't yet need this tool. But once you get to the cap, or if you're already above the cap, any county can use the tool. What it does is it allows for the state to participate at that continuing 65% of the non-federal share up to a 10% amount over a 3-year period. So when we say 10% amount, what we mean is whatever the total of the county wages and health benefits is at the time the tool is being used, 10% of that amount the state will participate in. So if it's $15.10, there'll be $1.51 that the state can participate in over a 3-year period. It doesn't mean the county has to use the full 10% amount. It doesn't mean the county has to do it all at once. The county can certainly do an increase for that full amount. It could spread the increases out over the 3 years. So a lot of options within how it would work. But if a county does increase wages and benefits above that 10% amount in the 3 years, then the county would be responsible for 100% of the non-federal share of those increases. And again, 10% is the total of the wages and health benefits. So under the 2017 legislation, all counties could use this tool up to 2 times and a 3-year period had to start prior to January 1st, 2022. Now with AB 135, counties can use this tool an additional 2 times on or after January 1st, 2022. And it doesn't matter how many times the county used the tool before that date. So if a county never used it, or if a county used both of those uses, they still get 2 new uses of the tool starting January 1st. Do keep in mind that a subsequent 3-year period can't start until the previous 3-year period ended. And so this means if a county is currently in a 3-year period from one of those first 2 uses, they still have to wait for that 3 years to end, even if it extends past January 1st, 2022, in order to start one of the new 3-year periods that is allowed. So let's walk through a couple of examples. Right now, if you're a county and you're below the state participation cap, say your wage is $14, health benefits 75 cents, there's still 35 cents available for the 65% state participation before you even need the 10% over 3 years tool. But once the county does increase by 35 cents and gets to the 1510 state participation cap, they would then have the ability to use a tool, and there'd be $1.51 that the county could secure state participation in for any additional wage and health benefit increases. In this example, this is one of the 2 uses that's allowed before January 1st, 2022. Now for a county that is already at or above the state participation cap, so in this example, we're talking about in 2022, so this will be one of the new 2 uses that's allowed. Say the county's wage is $16.50, health benefits of 50 cents, so the county totals at $17. So that county's 10% amount is actually $1.70. It's not 10% of the state participation cap, but rather it's 10% of what the county's total wages and health benefits is at that time that the tool is used, which is $17. So there's the $1.70. And next, we will talk about the process for determining what the MOE adjustment is for increase. It'll be added to the MOE. It follows the same formula as 2017. Again, applies to any wage increase, no matter how that wage increase is done in relation to a wage supplement or a 10% over 3 years tool. The formula uses 2019-20 paid IHSS hours as the starting point. But then if it's in a year past that first year, any of the applicable 4% inflation factors will be applied in the formula. It does look at overtime hours, so those are priced higher at the 1.5 times the increase amount. And then all increases become a permanent part of the county MOE, and they are subject to the annual inflation factor. So here's a graphic of the formula. You take your wage increase, multiply it by the number of non-overtime hours, then your 1.5 wage increase times the overtime hours, add them together, multiply it by any applicable inflation factors, and then the county share, and that determines what the total county MOE adjustment would be. If it's not in effect for the full fiscal year, it'll be prorated for that first year, annualized at the end of the year, and then added on to the MOE, and then subject to the annual inflation factor from there moving forward.
As with wages and as with the prior MOEs, under the IHSS MOE, health benefits, if a county locally negotiates, mediates, imposes, or adopts by ordinance a provider health benefit increase, then the county will have an IHSS MOE adjustment for the county's share of the non-federal costs of the health benefit increase. As with the wages, the state-county participation is 65-35 state-county for the non-federal share, and state participation is limited to the state participation cap. As Justin described, we did get a statutory change that prevented the flip in those sharing ratios, and so the health benefit calculation, the share of costs, will stay the same as it is now with wages. The calculation for the MOE adjustment for health benefits is very similar to that for wages, but the additional costs related to the overtime hours do not apply on the health benefit side. This is a newer piece. It was not included in the original IHSS MOE, but health benefit premium costs now also trigger an IHSS MOE adjustment. The state will pay 65% of the non-fed costs of those, and the counties are responsible for 35% of the share. There's no state participation cap, however, on the sharing in the costs for health benefit premiums. So whatever the increased amount in those health benefit kind of inflationary costs is going to be shared state county in the calculation of the MOE adjustment. I'm not sure if this still applies, but just wanted to note that if there were MOUs or collective bargaining agreements submitted prior to July 1, those are grandfathered in. So to the extent that those still exist, then there's no MOE adjustments for health benefit premium increases until those MOU or collective bargaining agreements expire. So just wanted to note that in case there were still some of these older agreements that hadn't yet been renegotiated.
We spent a lot of time in discussions with the state on non-health benefits. So we had a 2017 MOE, a 2019 MOE, and a 2021 MOE. And so I'll go to the second point that CDSS has the authority to determine which non-health benefits the state will participate in and do so in consultation with CSAC. That's because back in 2017 and again in 2019, we did not have much specificity from the state about which benefits they would or would not participate in. Just in March of this year, the state released ACL 2129. We spent almost 4 years in negotiation with the state on that ACL that lays out which benefits they'll participate in and which they will not. For the ones that the state will participate in, the county MOE is adjusted one time by 35% of the non-federal cost, and that's calculated the same way as a benefit, I mean, as a wage increase or a health benefit in terms of determining what the total cost is and what the hours are. And it's the regular calculation of within 35% of the non-federal cost. Non-health benefits are not included in the state participation cap. The state participation cap is just the wages and health benefits. And then the counties and public authorities receive the reimbursement for the non-health benefit costs through their public authority claim. So moving on to the next slide, this lays out which of the non-health benefits the state will participate in, which are safety equipment, masks, gloves, etc., transportation vouchers, life insurance, tuberculosis testing, and vacation holiday pay. But I want to emphasize here that the state does not have any way to automate the vacation or holiday. So if a county public authority were to agree in bargaining to have a vacation holiday pay, they would have to completely manually administer that benefit until the state's case management information and payrolling system is modified to accommodate that. And I would just say that I don't think any county wants to be the very first to go through that. It will be, I think, a real difficult benefit to administer. Next slide is on the non-allowable health benefit, non-health benefits. The state will not, there's no state or federal participation in paid union release time. Pensions, with the exception of the one county that has a negotiated pension benefit in their collective bargaining agreement. And then provider training stipends. There are some county public authorities that do have provisions for training stipends in their collective bargaining agreements, and those that were in effect between 2018 and 2021, the state will participate in. Any collective bargaining agreements that occurred after that ACL 21-29 was released, then are on their own to pay for stipends for provider training. I just would say I hope this is something that the state will reevaluate as they're implementing the IHSS career pathways, where the state would be contemplating paying for stipends.
We will now go next to IHSS collective bargaining, similar to wages and benefits. I just wanted to show a little timeline here of how things have been enacted and changed in the different iterations of IHSS legislation, really about impasse procedures and a realignment withholding being enacted and then subject to a sunset date and then reenacted. So we'll talk through all of that, but here's just a brief overview of the timeline for that. And I'll turn it back over quickly to Karen to talk about the impasse procedures.
Let me first say what this is not. The unions like to say that if the counties, public authorities don't bargain in good faith, that they're going to be hit with this big penalty. And Justin will talk more about the penalty later. There's very specific impasse procedures that are laid out in statute, and they're identical to the impasse procedures that were placed into statute back in 2019. So it starts off with mediation. Either party can request mediation from state mediation and conciliation services. There's a very strict timeline on when mediation has to take place, and then it can be waived by mutual consent. If there's not an agreement in mediation, then the parties would move to fact-finding. The fact-finding panel has to prepare a report within 30 days of being appointed by the Public Employment Relations Board, otherwise known as PERB. If there's no agreement reached at the fact-finding state, then that moves to the Board of Supervisors, which is required to hold a public hearing on the fact-finding report within 30 days of the release of the report. And then finally, there is post-fact-finding mediation. Either party can request post-fact-finding mediation. It has to be held within 15 days of the date that it is requested. If that is requested, then the fact-finding report is not made public until the parties proceed to post-fact-finding mediation. I would just mention that State Mediation and Conciliation Services has kind of a special unit of mediators that have had some training in IHSS. So we haven't had a lot of counties that have gone through this, but there is a pool of people that have special training at the state to help.
And then let's talk about, Karen briefly mentioned the penalty, also known as the realignment withholding. So AB 135, it did enact a one-time realignment withholding that could potentially occur, but again, this is only for counties without a collective bargaining agreement in place and after a series of conditions are met. I would just note that our organizations did oppose this proposal. We've seen significant progress on IHSS collective bargaining, particularly since the enactment of a more sustainable MOE in 2019. At the time of our advocacy, it was 46 agreements with counties to increase wages, either under the 2017 or 2019 MOE. That's up to 48 counties now. This covers more than 95% of the IHSS provider workforce and represents hundreds of millions of dollars in county investments. But ultimately, the legislation and the administration were determined to enact something to ensure those final few counties could get to an agreement. And so the realignment withholding was included in AB 135. We were successful in ensuring that the withholding would only be one time. It was proposed to be an ongoing penalty, but certainly a one-time withholding would be significantly more manageable. Hopefully no counties get to this point, but if it does, it would be just one time. And so here's specifically how it would work. So it went into effect October 1st of this year. There are the 4 conditions that have to occur before any withholding would occur. So the county and the union, there has to be an expired collective bargaining agreement. They need to go through that full mediation and fact-finding process that Karen outlined. The fact-finding report recommendations must be more favorable to the union's position. And then there's still 90 days after those fact-finding recommendations come out to reach an agreement before we would get to the realignment withholding. For any counties that had already had fact-finding recommendations released prior to June 30th, they had 90 days to reach an agreement before October 1st, before the withholding would occur. So the withholding is 7% of a county's 2020-21 MOE amount. It is done as an adjustment to the social services subaccount base within 91 realignment. So those funds are pulled from the county's base and redistributed as one-time general growth to the other subaccounts, so health, mental health, and child poverty. And then that county's social services subaccount base is restored in the following year. So once those 4 conditions are met, the union must submit a written request to PERB, and they also must notify the county. PERB will make a determination if all of those 4 conditions were met. Some of them are pretty straightforward. Some of them require some evaluation, specifically if the fact-finding recommendations are more favorable to the union. If PERB does determine that those 4 conditions were met and a withholding should occur, they need to notify the county and the union, and then of course the Department of Finance and the controller for the mechanism of that realignment withholding actually occurring.
I wanted to spend a little bit of time talking about caseload growth funding and 91 realignment, because that's where the IHSS MOE costs are factored into the realignment calculations. Social services is the sub-account, the only one that gets caseload growth, and it's actually a bit of a misnomer. It's not actually based on caseload, it's really based on expenditures. The timing of it is lags a little bit. Caseload growth for a fiscal year is calculated based on the expenditures from the prior fiscal year compared to those from 2 prior fiscal years ago. And then it's paid in the following fiscal year. So for example, 2021 caseload growth, which we've just determined as of the end of 2021 or beginning of 21-22, it's 2019-20 expenditures compared to 18-19 expenditures. And this 2021 caseload growth is not going to get paid until 21-22, or it's going to be paid hopefully this month. So in 2021-22. So there's a lag in the timing. So that's important to keep in mind when you think about when IHSS MOE costs may get reflected in terms of the caseload growth funding. The IHSS costs included in the overall social services caseload growth calculation, they only include the services costs. The administration costs are excluded from the caseload growth calculation. And that's because theoretically anyway, there's no county share of costs. The general fund is supposed to be fully funding all of the non-federal share of admin costs. And so in theory, there is no need to include those in the caseload growth calculation. So it is just the MOE costs, and those only cover the services costs that are included in the calculation. The thing to remember about caseload growth is that it is a net calculation. For all of the programs, what happens is that the decrease in increases in costs of all of the programs that are covered by caseload growth are all netted together. So you will have growth of expenditures in some programs and potentially decreases in expenditures in others. And those increases and decreases offset each other. And you come up with a net number, and it's that net number that becomes the total amount of caseload growth owed to a county. Now, the IHSS MOE costs were treated differently for a couple fiscal years. For 1920 and 2021, IHSS MOE costs were added after the fact to the net caseload growth amount, calculated for all the other non-IHSS programs that are covered by caseload growth. So that net number was arrived at, and then the MOE costs were added on top of that. And then that became a county's total MOE costs. And the benefit of doing it that way is that caseload growth fully funded all of the MOE costs for the expenditures incurred in 1920 and 2021. But starting with the caseload growth calculation for this fiscal year, the 21-22 fiscal year, IHSS costs are going to be included in the caseload growth calculation, just like all the other non-IHS programs. And that is when IHSS costs go up, and every year they will for every county because of that inflation factor. When those costs go up, that positive expenditure growth number is going to be netted with all of the other non-IHSS programs in the caseload growth calculation. And so at the end of that calculation, the result is that IHSS MOE costs could be offset some in that final caseload growth calculation by the reductions that might occur in other programs. So it's just important to know that there'll be that netting that goes on, and not all of the IHSS costs. You may not see the reimbursement for all of those costs through the caseload growth calculation. For this year, 2021 caseload growth, or for the caseload growth that is going to be paid this year, we actually have two things that are going on. Caseload growth for the social services sub-account is always owed. There is, it always must be paid. And if there are insufficient revenues in any particular fiscal year to fully fund caseload growth, then that unpaid balance is owed to counties in a future fiscal year when revenues are sufficient. And the oldest caseload growth is always paid first. So due to the brief recession that resulted from the pandemic and the revenue drop in the last quarter of the 2021 fiscal year, there were no 1991 realignment sales tax growth revenues available at all to fund caseload growth. So there is an amount of caseload growth owed for 2019-20, both for IHSS and for all the other programs. And you can see the dollars listed here on the slide. So this amount of funding, the $60.8 million for all of the programs, is going to be paid first. Then there is a 2021 amount of caseload growth that's owed. For IHSS, it's about $36 million. For all the programs, including IHSS, it's about $53 million. And that amount is also going to get paid when caseload growth is paid. There is sufficient revenue growth to fully fund both years of caseload growth that are owed. And the payments for both of those years should be made soon. The controller has the schedules and should be making those payments hopefully any moment. The caseload growth costs for IHSS for these two fiscal years, 1920 and 2021, are only going to reflect those cost increases due to the wage and benefit increases in those counties that negotiated them. Remember that because of the lag in the calculation, the 4% inflation factor has not yet kicked in. It doesn't kick in until 21-22, and so, or sorry, 2021. And so it is the 21-22 calculation where that inflator is going to come in, and that will be included for all counties in the caseload growth calculation.
Okay, so we're gonna wrap up now and turn it over to some questions. I just wanna go through our resources slide here. So a number of the wages and bargaining briefs that I mentioned and a couple other resources are available on CSAC's website. We've linked here the latest guidance in terms of how the MOE works, and then the county fiscal amounts from the Department of Social Services. And then for Department of Finance, we have that 1991 Realignment Report and those caseload growth numbers that Eileen just mentioned. Here is all of our speaker contact information. And with our remaining time, we're going to turn to questions. Again, as a reminder, you can submit those through chat and Q&A, and Roshina is going to lead us through that while I stop sharing my screen.
For the $1.70 example under the 10% rule, does that mean that the state would essentially be contributing more than 10% above the state cap?
Yeah, so the state will participate in 10% of whatever the county's total wages and health benefits are at the time that they initiate the use of that tool. So the tool can't be used until a county gets to the state participation cap. So for those counties that are just getting to the cap, it ends up being 10% of the cap amount that you can get participation in wages and health benefits. But if you're a county that's already above that amount, your 10% amount is greater. So it's based on each individual county and where they're at when they start the use of the tool.
Thanks, Justin. And then we have a couple questions, some clarifying questions regarding the penalty. Is there an idea of how the penalty will be taken from the state and where the funds will be used?
Yeah, excellent, good question. So there was one county that was subject to the previous iteration of the penalty under the 2019 MOE, and that penalty, it worked in the same way. And so what happens is once the controller and the Department of Finance and the county and the union, they're all notified by PERB that a penalty will occur. The controller adjusts the monthly social services subaccount base payment for that county so that it is reduced over the course of the year by the amount of the penalty. So when it happened in 2019, it was of course just 1% of the MOE. If it were to happen now, it would be 7% of the county's 2021 MOE. And then that funding is then redistributed among all the counties, still within 91 realignment. So it doesn't leave 91 realignment, but instead of being in that county's social services subaccount base, it's distributed as one-time general growth to all counties that receive 91 realignment funding as either health, mental health, or child poverty subaccounts, because those are the three that get general growth. It follows the exact same formulas that those subaccounts use for general growth, but it's not a permanent part of those subaccounts. So it's going to be clearly identified as one time. And then the county's social services subaccount base is restored by the amount of the penalty in the following year. So there's no ongoing base or growth impacts. So again, this did happen one time in 2019. The withholding was done properly. However, that one-time general growth actually hasn't been distributed yet, and we are currently working on ensuring that goes out. It is a very, very small amount, but it will go out. It will be clearly identified as one-time growth. And then certainly if it were to happen again, would go out on a quicker manner moving forward.
Thanks, Justin. Then there's another question regarding caseload growth. Will negative caseload growth in other programs offset caseload growth going forward?
Yes, that's correct. The caseload growth calculation is pretty complicated and kind of counterintuitive and a little arcane. But yes, if there is a reduction in expenditures in a particular program covered by caseload growth, but increase in IHSS MOE costs, then the two do offset each other. And it will be the net amount that is funded. So the short answer is yes.
If negotiated increase of wages happened in January of 2022, how does the adjustment work and when would it impact the MOE?
So it would be prorated in that first amount. So a county right now, shortly, there will be a preliminary MOE county fiscal letter release. It'll show all counties their amount for 21-22 that results from the final 2021 MOE and the 4% inflation factor. And then once a wage increase does go into effect, so in the example, it'll be in effect for 6 months of the fiscal year, that will be reconciled at the end of the year. There'll be a final MOE CFL, and the county will owe the difference for those 6 months that the wage increase was in effect, and there'll be a reconciliation with CDSS. And then prior to the next fiscal year's preliminary MOE, that amount will be annualized. There'll be the full year cost of the additional 6 months will be added on, and then that full annualized amount will be subject to the 4% inflation factor. And so that's how the county then gets billed for the remainder of it.
Okay. And then we have some follow-up questions regarding the penalty. Would the county that get penalized by the withhold of the realignment be allowed to receive a piece of the one-time growth amount?
Yes, actually, technically the county would. There's nothing that in the statute that says that county wouldn't get the general growth. And so of course it would be a much smaller amount than the overall withholding, but the county would receive a small portion based on their share of the growth schedules for those sub-accounts.
And then we have a question regarding the non-health benefit. Is there any cap on the transportation benefit that can be built in as a non-health benefit?
There is no cap on any of the non-health benefits.
Next question, is there any thought being given to caseload or other increases due to the expansion of Medi-Cal forthcoming, or will that not be fully realized for the next few years?
So county administrative costs for Medi-Cal are actually not included in the caseload growth calculation under 1991 realignment at all. And that is because the counties don't have a share of cost of Medi-Cal administration. And of course, we don't for the services piece as well. So those are excluded from 91 realignment caseload growth. We're of course at CWDA working to assess, at what point in time we would need to advocate for increases due to the expansion related to our administrative activities. And of course, the services costs are budgeted for elsewhere in the state budget. So Medi-Cal is a little bit of a different animal and is not included in 91 realignment caseload growth.
Can a county that has engaged in a local wage supplement in the most recent MOU plan for a new wage supplement in the next bargaining agreement with the state covering the 65% of non-federal costs?
Yeah, so with the wage supplements, there's no limit on how many times that can be used. So pretty much every wage increase a county does from here on forward, they should do as a wage supplement, so they will always float. So if you had a 50-cent wage supplement, 2 years ago, you negotiate a new 75-cent wage supplement, that full $1.25 as the two wage supplements will be added on every time it's applicable with state minimum wage passing the county wage absent that supplement amount.
Okay, and we're up on time, so this will be the last question. The question is, what was the thought process on the caseload growth calculation change? The counties are feeling that this will increase IHSS costs and costs will continue to increase. Is there additional revenue needed for IHSS?
So the caseload growth calculation was temporarily changed for IHSS to handle that transition from the MOE that had all the accelerated revenues to the one that did not. And it's complicated, I won't get into detail, but it just simplified the way that we transitioned out of factoring in that accelerated revenue in the caseload growth calculation. So the shift is actually going back to the way that the IHSS MOE costs were treated prior to the change in the MOE, and even prior to the MOE. So yes, these negative program expenditures will offset the costs. The theory, I'll just give you the theory, is that you counties actually have these savings associated with these reductions. And so it's not that the IHSS costs aren't being fully funded, it's that in part the savings that are otherwise occurring as part of this 91 realignment caseload growth calculation those are being used to fund some of the IHSS costs. I understand right now that that's just theory. We'll just have to keep examining as we go forward how revenues in 91 realignment are keeping up or not with IHSS MOE costs, and kind of assess as we go along, I think.
Excellent, great answer. Thank you, Eileen. Thank you, Roshina, for leading us through the Q&A. A big thank you to Eileen and Karen as well for partnering with us on this webinar. Again, we appreciate all the participants taking time today. Be on the lookout for follow-up materials when they are available. And thank you for your time and for joining us today on this webinar.